In a shocking turn of events, the muscles of the forearm are complicated. There are many of them and many layers of them and lots of movements that they're responsible for. For this video, I'm going to break it down, simplify things for you, and focus on the extensors, otherwise known as the muscles that extend your wrist and fingers, and also known as the muscles that contribute to tennis elbow. Welcome to the posterior aspect of my forearm. There are about 14 muscles that live underneath the skin in this area, give or take a few. But today, I'm just going to focus on 5 or 6, depending on how you break them down. But before I do, I know it can be overwhelming to look at these muscles on a muscle map or a cadaver, and I want you to kick that thought aside and think about them like this. There are 2 compartments of musculature that live here, the anterior flexor compartment and the posterior extensor compartment, the latter of which I'm painting in this video. Each of these compartments is divided into 2 more compartments, the superficial muscles, which lie just under the skin and tend to be bigger, and the deeper muscles, which lie deeper and tend to be smaller. As is true for most other muscles in the body, the smaller muscles tend to be responsible for smaller movements, and the bigger muscles tend to be responsible for bigger movements. But because there are so many movements that the wrist and the hand and the fingers can do, often most of these muscles are also responsible for creating stability. Before I get too far down that train of thought though, I want to put names to the superficial extensor group that I'm currently painting and offer up a quick lesson in Latin. The 2 bones in the forearm are the radius and the ulna. The word radius in Latin means straight rod or bar, and the word ulna in Latin literally means elbow, because this is the bone extending all the way from your elbow to your wrist. The other word that shows up here a lot is the word carpi, which also has Latin roots, meaning wrist, like the carpal bones that are in the wrist. So if you look at the names of these muscles, they will tell you if they're going to flex or extend the wrist and fingers, and if they're closer to the ulna or the radius, and that they cross over the wrist. As I highlight the connective tissue that extends out from these muscles to latch onto the bones, otherwise known as tendons, the last Latin term I'm going to offer up is the word digitorum, which translates to mean of the fingers or the toes, depending on which digitorum you're talking about. Clearly, there is more Latin than just that in the forearm, and there are way more muscles here than just these. But if you think about all the movements the wrist, the hand, and their collective fingers can do, and you make friends with Latin word roots, all of this can feel a little less confusing. There's more. Understanding all of this incredible anatomy actually has some pretty great practical applications. Knowing how to approach dysfunction in this area is not only helpful for you, but possibly if you have a client with tennis elbow or just exhausted forearms. With your client supine, start by reminding them that their arm is connected to their torso, and then warm things up. I'm using my left hand here to stabilize my client's wrist and hand, gently, trying not to cut off any blood flow, and I'm using my right hand and my right forearm to create a lot of warmth and heat. If there's one thing I know about an area that houses a lot of little muscles, that means there's a lot of connective tissue, and when there's a lot of connective tissue, things can stick. Generating some heat is going to decrease the viscosity, which is going to increase the fluidity, which is just going to allow you to sink down into the deeper muscles and offer some relief to that which is tired. Before I get too far detailed into the work of the extensors, I want to pay attention to the flexors as well. Because here's the thing about tennis elbow. The irritation of the common tendon at the lateral epicondyle happens because the extensors aren't necessarily extending the wrist and fingers as much as they are resisting flexion. This is considered an isometric contraction, which requires stability, which means everybody's chiming in to help that ball get over that net. So as I start to sink in a little bit deeper between these muscles to create some separation, I don't want to ignore their counterpart. Teamwork is essential for a lot of muscles, but this is especially true in the forearm. Now that that superficial layer is warmed up, I'm going to offer a bolster under the wrist and hand, which is going to support the natural bend of the elbow and offer that common tendon some slack. Using my left hand to support my client's wrist and hand and distract away from the work that I'm doing, I'm leaning in with a soft forearm, creating a deeper compression, and focusing on unwinding the tight grip of those contractile fibers. This may be enough pressure and depth for your clients, or it may even be more than enough. But if you want to sink down a little deeper, you can switch that soft forearm to an elbow. Be sure to stay connected into that muscle tissue and be sure to stay in communication with your client. Because the last thing we want to do is irritate an already irritated situation. Remember that you're most likely dealing with a tendinitis or a tendinosis. So even though these connective tissue layers need and require rest, helping the muscle fibers to let go of their grip is going to invite a lot of relief. Friendly public service announcement: make nice after you've done some deeper work. Kindness, after all, is a powerful tool. Switching gears a little bit, I've lifted my client's wrist and hand off the table, flexing her elbow, and the work I'm about to do is reminiscent of the work we might do when our client is prone and we lift their foot up off the table, bending the knee, and work through the tension of the calf by switching perspectives and changing the position of the foot. When a hand is not grabbing a tennis racket or the myriad of other things that can make a forearm tired, it is typically dangling down to the floor. Taking gravity out of the picture, I can use one hand to slide down these ropey muscles, either with flat finger pads or specifically sinking into this tension, and I can use my other hand to manipulate how these muscles are situated underneath the skin. Just so that it's super clear, flexing the wrist is going to soften the flexors and stretch the extensors, and extending the wrist is going to soften the extensors and stretch the flexors. Both are good, both serve a purpose, and all of it helps. So most of these muscles, as we saw in the earlier part of this video, reach down through the wrist and grab onto various parts of the hand and fingers. So yes, you want to pay attention to the hand, but you also don't want to forget the wrist. There's a lot of connective tissue merging here and even more connective tissue holding it in place. Bring a little friction back into the game, warm things up, add a little fluidity, and give them a little more glide. I've finally gotten down to the hand, and while this work may seem like the icing on the cake, I want to flip things around. Really detailed work into the hand and the fingers can feel exceptional. But if we don't take our time and work through each element, the tiny little muscles in the palm of our hand, in the dorsal aspect of our hand, in between our metacarpals, the tendons that are reaching through and attaching onto those first knuckles, extending beyond there and attaching onto the fingertips, the sheaths in which those tendons live, and all of the fascia that surrounds all of that. The demands that we place here are going to make themselves at home. Okay, so it's not like our hands are the cake and everything else is the icing, because that would be a funny cake. But working with an issue like tennis elbow or tendinitis, or just exhausted forearm tissues, doesn't mean that detailed work along those connections isn't equally as important. A cake without any icing is still a good cake, but when it's layered and embellished with different ingredients and decorations, it's a lot more enjoyable. My point is, there's a lot more to tennis elbow than tennis. There's a lot more to tired forearms than forearms. And there's a lot more to healing through pain than focusing on what's in pain. Also, just to be clear, your hand's not a cake. Don't eat it.